Hello, and welcome to this presentation of Let's Talk, presented by the Visiting Nurse in Hospice for Vermont and New Hampshire. I'm your host, Anthony Knox, and I'm the Community Relations Manager for the VNH. And today, after various presentations that we've done talking about all of the different programs that we have here at the VNH, we're joined by the CEO of the VNH, Johanna Beliveau, to talk about all of our programs, how they are a benefit to an individual, how they all kind of work together with one another, and also to talk about our collaboration within Dartmouth Health as one of the many affiliates of Dartmouth Health. So, Johanna, thank you for joining us this afternoon.
Thank you, Anthony. I'm very happy to be here.
Excellent. So, as I like to do with those that are on Let's Talk, just talk a little bit about your background, how you came to be within your leadership role here at the VNH, and also what it is within the VNH that attracts you versus going into the quote unquote typical hospital setting, which obviously. We all know the VNH is not that typical hospital setting.
No, it's not. And those things are very closely connected. So I am a nurse by background, and I'm very proud to be a nurse, and was very fortunate in my nursing school experience to be able to spend some time shadowing with a home health and hospice program when I was a student. And that really opened my eyes to the possibilities of what nursing could look like outside of the four walls of a hospital or a clinic. And it really just resonated with me. So very early in my career, I went into hospice nursing. So I spent about 10 years focused on hospice care, first as a clinician, and that's actually where I started my leadership career. I became a manager and then a director, all focused on the interdisciplinary care provided to people at the end of life, which was just a wonderfully rewarding experience for me. Then my career, I took an interesting trajectory. I've done a variety of things. So after my time in hospice, I did some focused work in quality and safety and regulatory readiness. And then I worked in a children's hospital for a number of years doing some of those things. And when I joined Dartmouth, had an opportunity to really develop in my nursing leadership, working as a director and then as an associate chief nursing officer within the health system. When this opportunity opened up, it felt like the right next step for me in my career, bringing my love for home and community-based services, my experience as a hospice nurse, the work that I had done in developing as a nursing leader into this role as CEO for the Visiting Nurse in Hospice. So that's the path of how I came to be here, and it's really been a wonderful experience.
Well, and it's interesting hearing the path that brought you to the VNH, because there are a lot of the stops that you have made along the way before getting here. You've experienced a lot of the different programs that we offer within the VNH. I mean, obviously hospice being a huge piece of that, but even, working at a children's hospital and kind of understanding that children's side of things, with our maternal child health program, and then obviously being able to, utilize those skills in the home health setting, but then, with everything, being able to work on your leadership and continue to kind of progress within that leadership chain to obviously where you're at now. And so that kind of trajectory, obviously led you to the VNH. And how long have you been as the CEO of the VNH?
Yeah, thanks, Anthony. I've been here for 4.5 years now. It's been a very interesting time. A year and a half into my tenure here at VNH was when COVID came into our communities. And so we've done some different things over these last few years than what I originally expected we would be focusing on and spending our time on, but very, very pleased that we've been able to continue to bring care and services to the communities throughout the pandemic and really reaching people where they are safest, which is at home.
Right. And I think that's another piece too that probably a lot of people don't understand and don't know unless they've received services from the VNH over the last, almost 3 years now that the pandemic has been rolling on, that, the VNH has continued to provide supports. Talk to me a little bit just about kind of how things transition to where we're at now as far as providing the supports, because obviously everything's going great, no issues. We're providing supports at home. Pandemic hits, and we obviously have to change some of the ways in which we're providing that support, but still not stopping providing that support at home.
Right. Yeah, no. We're very fortunate, like everyone in healthcare and really any industry, everything sort of got paused when the pandemic hit, and we were all trying to figure out how do we continue to provide services in the safest way possible. And so after what I would say was just a few weeks of really having to scale back to make sure that we were keeping our staff safe, as well as keeping our communities and patients safe as we were entering into their homes. Once we had all the personal protective equipment in place that we needed to maintain good infection prevention practices, we've been doing the work right along. So by May of 2020, we were really resuming our care and services as they had been prior to COVID coming into our communities. And I'm really proud that we've been able to do that over these last 3 years. And really, it's been somewhat seamless from that regard.
That's awesome. Yeah. I myself personally, just starting here December of 2021, and obviously all of this stuff was already in place. You guys had been rolling. Things had been working well, and and it seems like the patients are still getting the exact same care that they were getting before. We just might be wearing a few extra layers of stuff when we go into the home. So
that's right.
Perfect. Yeah. And obviously pre-pandemic, currently within the pandemic, and post-pandemic, we offer a variety of services through the VNH, and like I had said at the top of this, that we have presentations that we've done to go way more in depth as far as all of the services we provide within our home health team, our hospice team, our maternal child health team, the long-term care team, and our help at home team, as well as even a conversation about how you could donate and support the visiting nurse and hospice, and all of these programs work together to provide well-rounded supports for an individual, regardless of what stage of life that individual may be. And so from your perspective, Johanna, talk about just kind of how these programs do truly, work together to provide the support, and, aspects of these different programs that, potentially are the most beneficial for individuals who are seeking our services.
Yeah, sure. So as Anthony just mentioned, we do have a number of programs that really do help and provide support through the span of life. So, we begin our work with pregnant women and soon to be mothers as they are gearing up for that first or maybe second child, and spend time with them, early in the life of the baby, all the way through hospice care, which is the end of somebody's life. And having the programs that we do, which focus on specific areas. So we bring you the specialty service that you need for whatever that might be at the phase in your life. If you're an older adult, just having potentially a knee surgery or a hip surgery and you need some rehab at home, we have a specialized team who does that work. If you're someone who is managing multiple chronic illnesses, and we have programs through the state of both Vermont and New Hampshire to allow you to stay at home and bring support and services to you directly at home. Our maternal child health program, which again starts with that mom and baby care early in life, but also doing medical intervention for kids who have illness or injury. All of these programs are very highly specialized to bring you that service that you need at home. But they also work closely together to recognize what your needs might be that are outside of their particular service area. So as an example, if we have a pediatric palliative care patient who is nearing the end of their life, then we can collaborate with our hospice team to ensure that that patient and their family have everything that they need as they transition into that next phase of their journey. If we have a patient who's on our long-term care and services program, but then needs to have a joint replaced, then we refer them over to our home health program, who can be there for that short period of time for those rehab needs, all the while that they continue to maintain their long-term care services and supports. So it is both highly specialized, but also integrated across all of our programs and really throughout the lifespan. I think that's one of the things that's so unique about the work that we do here at VNH, is that we cover a lot of territory, both geographically and from a service perspective, but we're small enough that we do know each other. And these are leaders who work together every day, connecting on what are the needs of our patients, and how do we ensure that we are bringing the best of what we have to offer to people in their homes. You asked a question, Anthony, about what I think is sort of most important, and what I see is the isolation that can happen for people. And again, this isn't just about older adults who we often think about as being isolated at home, but really anyone who's working through an illness or an injury, or someone with chronic illness issues that it prohibits them from getting out as often as they might like. They all experience some sense of isolation. And what VNH does that is so important for our communities and their well-being is bringing this needed care and service to them in their home in the safest way possible, connecting them to their providers, whether that be through telehealth visits or remote visits, or just even a phone call from the nurse or the therapist in the home to say, here's what I'm seeing today, and we really need help with this, that, or the other thing, the coordination that we can offer. But by being in the home with people, developing that relationship with them, broadening their access to healthcare, services, and also just, being a contact and a friendly face for some people who don't get that.
Perfect. Yeah. And so one of the things you had touched on around, specialized services for, our different programs and things like that. So I know that at one point there was a little more overlap as far as staff members being able to, work with home health patients and hospice patients and things like that. And within the last year or so, last couple of years, the focus has been to have specialized services for the therapies that we're providing, or the PCAs and things like that. That it's specialized for home health, specialized for hospice, for the maternal child health program, and things like that. And so, what talk a little bit about why that decision was made, and how successful it has been in providing that more specialized care with specially trained individuals for those different programs.
Yeah. So the why is really just what you're describing, right? So each of those areas has its own set of knowledge and science associated with it. So to be a home health clinician, nurse, or therapist, you're working on, helping people to recover, recover from injury, manage an acute illness. It's a very different skill set. The things that you need to be aware of, knowledgeable about, be able to teach our patients and their family or caregivers around, very specific set of skills, which is very different. And working predominantly with older adults, that is predominantly an older adult program, is a very different skill and knowledge base than working in pediatrics, or a very different, skill set from working with people at end of life. So that's what drove the decision, is that we wanted our clinicians to have that specialty knowledge, to really be able to sort of dive into their work and be the best potential clinician that they could be based on whatever program that they were working in. because our patients deserve that, right? Our patients need that expert walking into their home who can really help them with whatever they're facing in that moment. And so that's really the reason behind making that change over the last few years.
Yeah, to me, that made all the sense in the world when I came to the VNH, because in all honesty, I'm not going to go see a pediatrician at 37 years old. Like, I'm going to see an adult doctor to be able to work through my adult issues, and so it's very similar to, I would want someone who is specialized in the home health recuperating side of things to come in and support me versus someone who may be more on the end of life spectrum and when providing that comfort care and things like that. So that makes total sense to be able to shift the focus to be more specific to those individuals who need that specific care. So that's beautiful. So
it's also more satisfying for staff, right? So it's hard to be a clinician and to be expected to maintain such a wide scope of expertise or knowledge. So it's a much more manageable and satisfying experience for our clinical team to be able to specialize and focus and really develop a deep knowledge in their area of specialty.
Awesome. And so the other, maybe one of the biggest pieces of the visiting nurse and hospice is that we are an affiliate of Dartmouth Health. People watching this presentation can see the Dartmouth Health logo down at the bottom. We went through the whole rebranding process earlier this year, and I personally thought it was very successful to work through that. But the thing with visiting nurse and hospice is that we are completely different than all the rest of our affiliates. All the rest of the affiliates are hospitals. You have to go to them to seek that support, to seek the treatment modalities that you need at that point. And the visiting nurse and hospice, we come to you. We will come into your house. We'll come into wherever you need us to provide that support. And so, From your perspective, Johanna, the relationship that we have with Dartmouth Health, talk about how it's such a benefit for individuals seeking care, that that continuity of care can stay very consistent, because all aspects of your treatment modalities can be addressed wherever you need it.
Yeah. So I think I'll start with the ability to coordinate care across the multiple members, right? And so we have had many of our patients who maybe they receive primary care services at Alice Peck Day or Mount Ascutney Hospital and Health Center, but they have a specialty surgery at Dartmouth Hitchcock Medical Center as the specialty service area for whatever that person needs. And then they come home for that post-surgical care and often rehab needs. And now that we are all on one shared medical record, no matter where that patient has been seen in the health system, all of us have access to their information. So we can see what they've been working with through their primary care appointments. We can tell if they ended up in the emergency department for some unexpected reason, and we can see those notes and have that communication. We can understand what happened during a surgery and what those post-discharge instructions were, and then vice versa. The primary care and specialty providers at the medical center or one of our community-based organizations can see our notes, and they can see what our team is doing and how patients are responding to the services that we're bringing to them at home. So our ability to really, truly coordinate care, talk to one another, the team can instant message each other, in basket or email each other right within the medical record, which is really a phenomenal asset to be able to adjust care sort of in real time as things are needed for our patients. So that's one piece. It's really about that coordination at the individual patient level by being able to access information and be able to access each other in a timely way. Then if we bring it sort of up a level to not a specific individual, but really how do we operate as a health system, it's the opportunity to understand what populations of patients need throughout their care journey, right? So what is it that they need for some planned procedures or planned hospitalizations for things, are there ways in which the visiting nurses can get involved and understand and sort of pre-plan for activities that will need to happen at home once they're discharged? Then, so we coordinate that. Depending, again, we can working with cardiology or orthopedics, infectious disease, all of these specialty programs. We now have the opportunity to look at that across a patient population and develop what's the best care pathway for people to receive care and services for what they need, depending on what's going on for them. So we look at it more globally at the population level, as you will. And then the last, or not last piece, but one of the things that I would emphasize is, as a small home health organization, we have access to incredible resources through the health system that we just wouldn't have access to. So things like there's a new device that our clinicians need to be trained on, and we have a whole host of resources in clinical education and our variety of our system members, whether that be a partner in a critical access hospital or the academic medical center. We can bring people in to have training and share in resources like that. There is a number of professional development and continuing education opportunities that our team can now access because we're a member of this much larger health system with these resources devoted to professional development and education, things that we could never afford to do as an independent, small home health organization. So it really does bring a tremendous amount of resource to our clinicians, which ultimately benefits our patients because they're continually learning and partnering with providers throughout the region to advance our knowledge and understanding of what our community needs and bringing that care and service to the home.
Yeah, and I think that's a great summation there for the benefits of working within the big system, but still understanding that we are for lack of a better term, a ma and pa kind of agency where we're able to provide that very individualized care where you feel like you are at home because we're providing that care in your home, but it's almost that feel. I mean, I know when personally when my grandfather was going through hospice and VNH was coming in to provide those supports, you really got that vibe of people genuinely caring but they're local to this area. So it's never a question of, you can say, oh yeah, so-and-so, and they're like, oh yeah, I know that person. Or, you're talking about a location or whatever, and you don't have to give street addresses. You're like, yeah, you take a left at the big rock and, you go 100 feet past the oak tree and things like that. And people, it's that down to earth kind of vibe that you're receiving, but still having the backing of a larger organization that provides additional opportunities and training for our staff to be able to just provide the absolute best care possible to our service area, which, I know you alluded to at the beginning of this, of 4,000 square miles that we provide throughout Vermont and New Hampshire, and also being an agency that actually provides support in Vermont and New Hampshire versus once you hit that Connecticut River, that agency, doesn't tend to cross the river at that point. So, just a lot of pieces with, small town feel with, big city dreams, behind it kind of thing.
Yes, it is very much that small town feel to it, as you say. Our team members live and work in the same place, right? So it is not uncommon to be taking care of neighbors, friends of friends, sometimes extended family members. It happens when you live in small rural communities like we serve here throughout this, our region, which is 3 counties in Vermont and 2 counties in New Hampshire, and some parts of each of those areas, it's a pretty big territory, but 140 towns, right? I think is what we say, right? That we've counted 140 towns that we go into. And it is that very much that small town feel. And you know the clinical team, the nurse or the therapist who's coming into your home oftentimes. And I think that's a real asset for us. People feel comfortable with our team. They often know, they grew up with these people, or they went to high school together, or their kids played soccer together, or in whatever way that our communities get to know each other. It is really a nice thing to be able to bring that kind of service into the communities where you live.
Absolutely. So, I don't want to take up too much more of your time, but just from a kind of a closing thoughts type of perspective. I mean, are there any additional things about the VNH in particular that you want people to know about, that, you feel is really important, and just a message to be able to get out to all those that are watching live or watching this recorded after the fact?
I think it's, home-based care is sort of the unsung hero of healthcare, in my opinion, right? I mean, we are able to really do so much for people in their homes, and raising awareness like this about what our capabilities are and how we can bring all these variety of programs to people in their homes, both for patients and families out there seeking services, but also for providers who feel like they have that person who they know needs something at home, but they may not know whether or not VNH can do that, or in another community, another type of home-based care organization. So I encourage people to keep asking questions. There is more and more that we can do at home, and if we can't do it, it's worth exploring. What would it take? Sometimes, healthcare is changing, right? If things look very different today than they did even 3 years ago at the beginning of the pandemic. Many more opportunities to think about providing care outside of the walls of the hospital and the clinic, and so this is just a reminder that we are here. We are here to serve the community. We are continually trying to improve on what we do and to bring different kinds of services to people in their homes. So if please ask about it. You may have an idea that we haven't considered, and that's part of what we do, is continually trying to adapt to meet the needs of the people that we serve.
Perfect. Well, Johanna, thank you so much for taking the time to talk about VNH and all the different aspects of it. And again, like we talked about at the beginning, all of our programs have their own individual YouTube video that you can watch and just learn more information. But like Johanna said, sometimes it's just as simple as picking up the phone and calling us, shooting us an email. You can go to our website, vnhcare.org, and it has all of our contact information, all the avenues in which you can reach out to us. And we're here to support the community at large and be able to support you in the most comfortable setting possible, which hopefully is your home, and can work with you to provide those supports, to get you back on your feet, to help you with the end of life, whether it's you or your family. We do a little bit of everything, and if there's stuff that we're not doing, let us know and we can see what we can do to make that happen. But again, Johanna, thank you so much for taking the time and chatting with all of us today.
Yeah, you're welcome. It's a pleasure.